Great. So we are now live, and hello, everyone. We hope you're enjoying Digital Front Door Day. My name is Liat from Hyro, and I'm thrilled to be your session host. Thanks for joining us. Feel free to type your questions in the chat, which I'll be moderating. Our speakers today are Pam Landis, SVP Digital Engagement at Hackensack Meridian Health, Sarah Richardson, President at This Week Health, and Sonia, of course, Sonia Singh, our moderator, Chief Insights Officer at Avia. She'll be moderating the discussion. So great to have you ladies here. Sonia, the mic is yours for more in-depth intros for everyone.
Thank you. And just as an introduction of myself, I am the Chief Insights Officer at Avia. I lead our market intelligence and trends and thought leadership around all things digital. So we work with health systems on digital strategy, digital transformation, finding the right solutions. And digital front door has been a big topic with health systems we work with for several years, and it's still not easy. And so I'm excited to get into this conversation with Sarah and Pam a little bit further. Before I get into some of our questions, maybe a little bit more on your backgrounds. So maybe Pam, we'll start with you. How long have you been at Hackensack? Tell us a little bit more about your role.
Yep. Thank you. Thanks, Sonia. I'm glad to be here, everybody. I've been here at Hackensack Meridian Health for 5 years. I lead a team of almost 400 people who work what we call in the digital engagement space. And that's really for us 4 domains. The team works in acquiring patients, digital acquisition, and really analytics around that acquisition, activating those patients when they come through the door, providing them access through our access center, and then finally getting them to adopt our tools using our virtual tools. So they really work under those 4 domains across our entire network.
Great. And Sarah, I know you bring a pretty rich and varied experience across the ecosystem. Tell us a little bit more about the perspectives that you bring in your background.
Sure, Sonia, thank you. And Pam, just fun to be able to present with you. I am Sarah Richardson. I'm currently president of the 229 Executive Development Committee within This Week Health, because we also have Director Ford, who leads cyber and risk. We are, as This Week Health, a company dedicated to transforming healthcare one connection at a time. We do that through a series of podcasts and media events, in-person events as well. And I've been here since May, but I've been in healthcare for almost 25 years, in IT for 30. Worked for HCA, worked for Optum, worked for a lot of really unique and very special healthcare organizations. Had the opportunity at this point in my career to bring that all together and serve many instead of individual organizations. So I get to talk to 50 plus CIOs, the CXOs, et cetera, every single week. Absolutely love that, especially the partnerships with organizations like Hyro. So it's just an absolute joy to be here and talk about a topic that is part of our everyday ecosystem.
Yeah, I share that, Sarah. It's such a great experience to talk to many health systems who are all trying to address this problem and just see the progress we're making together and the challenges that we're overcoming. Pam, I'd like to dig into a little bit more in your background and just in your team at Hackensack. How are you approaching digital transformation, patient engagement, digital funder? Maybe tell us why you started there. What are the goals you're trying to achieve? You already started telling us some of the pieces you're working on.
Yeah.
What is some of the end goals you're working towards?
I have a fundamental view. I started in this business in 1996 at Johns Hopkins
Hmm.
and worked at Henry Ford Health System and then at Atrium Health. Uh, I have a fundamental drive in that healthcare is too hard to access.
Yeah.
Too many of us who work in healthcare, as soon as I got a job in healthcare, my whole family was like, oh, good. Can you get into? Can you help
Yeah.
me jump the line? And we all become personal concierges for our families and our friends. And it's wrong. And there are too many barriers to healthcare. Some of them are regulatory imposed barriers, some of them are cultural barriers, and some of them are we're just not ready to accept the change that's happening in the marketplace barriers. So my big focus for the last 20 some years has been, how do I make it easier for people to get access to care? Because when you talk to people, when they get access, once they see their doctors and their nurses, they love them. They love them. They get really great care. They're really happy with the people that they're seeing. Um, but we make it so hard to see those folks. And those barriers that we put up are artificial
Hmm.
because we're afraid that, I once had somebody said, well, what happens if I do online appointment scheduling? And I said, you're going to get more patients. He's like, I'm going to get a lot more? Well, not more than you can handle. I mean, we're not going to do that. Yeah, you're going to get more patients. People are going to come see you. He goes, all the time? Yeah, they are. Yeah, because you're that good and we want them to see you. Like
Yeah.
you have a gift. Share it with the community and it'll be a good thing. So that's what drives me is, and when I hear people say, well, we're a really patient-centric organization,
Mm,
I always laugh and think, does anybody out there ever say, I'm not patient centric, that I'm
right.
really revenue cycle centric?
Right.
I mean,
That's right. Who would say that? Yeah.
I know. And so I'm like, well, what does that specifically mean when you say you're patient centric?
Mm,
That mean you're going to expose your schedules so anybody can make an appointment. And that's the kind of stuff that I want my team to work on, to challenge some of that work, but also have the knowledge of how people use digital tools to manage their life. And how do we build these tools so that it's built into the rhythm of a person's life?
yeah. Yeah. I think that's so profound, and I appreciate the personal passion for this as well, because I think that's what we need more in healthcare. It's there's the business of healthcare, but I think the like let's make it human centric, person centric, patient centric is really what's going to make the big difference. So appreciate you sharing that. And Sarah, you said you talk to 50 plus CIOs each week. You're bringing this broad perspective of trends that you're seeing. Tell us a little bit more of what trends you're seeing. How are CIOs tackling this digital front door need, this initiative, the consumer needs that are evolving?
Sure. I do want to touch. Thank you, Pam, for bringing up the whole point about being patient centric and becoming the navigators. So I'm at that age where several of my friends, their parents are in
Mhm.
that space where elder care is part of their everyday life. I've already been through that journey. So people call me often, but this week, helping people navigate the right oncologist, the right cardiologist at two totally separate healthcare systems in two different states. And I think how grateful I am for the job that I've had for so many years because I know somebody at that hospital in LA. I know somebody at that hospital in New York where I can actually make sure that, heck, even if it's me calling you because somebody needs care in New Jersey, I know I can get to somebody who can help take care of them. So that's always such a huge win in what we do every day because sometimes, especially in IT, we're patient centric and we don't get to be near the patient that often. I mean, I used to think about rounding in the hospitals was one of the favorite things I got to do is go see patients in real time and really understand how they were
Mm,
experiencing us. The conversations, though, back to your question, Sonia, about what I hear CIOs talk about often when you say it's patient centric engagement, prioritizing the digital experience in the most seamless way possible. That does mean offering things like online scheduling and creating those blocks where they can get to their provider potentially via telehealth. So it's one thing to be able to make your appointment online, it's another to be able to make it online and see somebody that day and have the choice of
yeah.
have to be your PCP. I just need somebody to either refill a prescription because it's been a year since I came in and I need to schedule my physical anyway, or I have something going on and you're like, I don't need to come in for that. I can see anybody. And that availability is such a huge win when you're a patient and need to access it. And then making sure that our portals make care accessible in terms of finding information, in terms of finding the right doctors, getting the right information. So maybe you don't even need to go in, the education about, oh, I can take care of this thing that way. All of us are patients. Now, whether or not we're a patient of our own healthcare facility is another scenario based on insurance and other particulars, but I encourage us all get care where we provide it because then we know exactly what it's like. And I don't mean like going down the hall to get your prescription refilled or to get your appointment. Try calling your call center or try accessing your portal for you and your family. It is a vastly different experience than being inside the four walls and having access to the people that you need. Big pieces too, I hear people talk about often is the true integration with the EHR. Some of the HR providers are like, hey, you use our portal. This is why it was designed. If you're out there doing it on your own, then you are literally on your own. Some of us heard that this year. And the integration of those tools is really, really key. It's going to help with improved care coordination primarily and the real-time data access that people need. The last piece I want to touch on is that personalized communication. The emphasis that CIOs are placing on chatbots, on tailored outreach, on improving the engagement and satisfaction from your most recent visit, all things we can partner with Hyro to do, as well as understand that if we're bringing a point solution in, it needs to be seamless for us to integrate it as much as it is for the patient or the clinician to utilize it. That takes a lot of homework on the back end before we just go find something that we think is going to be amazing and really put it into the workflows that we are experiencing every day.
Yeah, those are great trends. A lot of different things that we covered, and we'll dig into some of those. When I've talked to CIOs, CDOs, one of the things I remember one chief digital officer told me, he's like, Sonia, the real purpose of why we exist is to relieve anxiety for our communities. Sometimes it's not just delivering care. Sometimes it's just getting them to an answer, because navigation and understanding healthcare is so hard. Sometimes you just want to know how much something will cost, or should I wait or go in to see an appointment, to get a visit. So it's just like, how do we relieve that anxiety when just so many people don't know? And health literacy being fairly low overall, how do we relieve anxiety and provide answers, information, advice, access, and visits? So I think Digital Front Door can cover a lot of those aspects as well, but it is challenging. So to move on to what are some of the big challenges, and we'll get into operationalizing and change management a little bit, but at a macro level, as you think about the biggest challenges in patient engagement and consumer engagement, what do you see as some of the bigger challenges, particularly in integrating digital solutions into traditional healthcare settings?
So I call it like our EHRs and the patient portals that come with them all.
Yep.
And I've looked in many of them and created many of them.
Okay.
The walled gardens of mediocrity. Nobody opens up their existing patient portal and says, this is really making an improvement in my life. We're opening it up because we actually just need to see that lab test.
That's right. Yeah.
But I like open up my Bank of America app. And I'm like, boy, this is really good. Like I can do things on it that can help me. When somebody said, like when I talked about the rhythm of my life, yeah, I can check on this, pay this bill, send this check, Zelle my kid. I can
That's
do
right.
things that solve problems for me. I have a job to be done, and this app solves that for me. What our patient portal strategy and our EHS strategy is, it's a read. I read this, but I don't act on this, and I don't know what to do with this information. So I go and I look at my lab results once a year, and then I don't log into the patient portal again. There's no reason, because my blood I haven't had it tested in the last 6 months, so I'm not going to go look at it again.
Right.
Why am I going to look at it again? So it's that kind of stuff that I think that we need to really focus on. What are the services that we're integrating in and around these EHRs and these patient portals that'll integrate into them, that will actually give patients the tools they need to manage their healthcare? One, we're going to give them better access, and two, we got to give them tools to better manage it. And I think we've got a lot of work there to do.
So that's a great phrase, walled gardens of mediocrity. And you're right, it's just information portals. It's not engaging like your Bank of America app, or I think about the Marriott Bonvoy app, or any of your travel. Like you get sucked into it and you're engaging on there and solving problems and improving your life, and versus just getting information that you're often not in a very organized or pretty way.
How horrifying is it that my United Airline app is better than our patient portal apps? Airlines.
Yeah.
Airlines, for goodness sakes, we've got to do better. And so that's the kind of stuff I think that we need to focus on. The other point that Sarah made earlier, though, I think is really important. She really was talking about how people select care. Convenience trumps everything.
Yes.
And for growing numbers of people, they want you to get out of my way to give me access to care now. And so that's why virtual tools are going to work better. Virtual visits are going to work better. But that's why disruptors are still in the market and trying to figure out this market, because people want access to care now, and they will prioritize that convenience over everything else. They are loyal to their doctors the moment they see them. And then you have to earn their loyalty back every single time. It's not like, oh, I could never go anywhere else. Well, if I call up my doctor and he can't see me, guess what? I'm going somewhere else.
Yes.
I'm going somewhere else. Bye-bye.
I do the same. Yeah.
My loyalty is for sale every day.
Yeah, we worked with Providence a lot, and one of the leaders there used to say, as health systems, we think we're in a monogamous relationship with the patient, but it's not true at all. The patient is shopping around, and we just need to start to accept that, and then see what do we need to do to respond to those trends versus just hope for a way that was before, where you are very loyal and the patient didn't have choice. When you look at what Amazon is doing and all the other providers where you can get convenience quickly, the click of a button, 3 clicks, 1 click or less. How do we start to respond to that level of consumer need and engagement in that traditional healthcare setting? I think you said all the right challenges of the EHR. We have to change a lot of that mindset. Sarah, what do you see and what do you think about in terms of challenges?
Yeah, I love what Pam shared, because today at 3:45, I have my COVID booster for the year. I'm getting it at CVS because it's convenient. I can literally walk there from my house, and I couldn't get into my regular provider for another couple of weeks. The challenge in that is, great, I'm doing what I'm supposed to be doing, and yet because I get my flu and my COVID vaccines at CVS, they don't load into my patient portal at my provider. And so my provider sending me a message yesterday saying you still need your flu shot. They're automated. I'm like, I already got my flu shot. So can someone from CVS please send my records over to the provider? Well, I asked, and they're like, well, you could upload them. I'm not going to do that. Like, it's just, I'm not. I'm going to tell you I did it. I'm a responsible human. I did all my vaccines this year, but I'm not going to take the time to log into CVS, sit down, upload it into my patient portal. I'm just not going to do it. And I'm someone who's in control of my care, as an example. So 100%. And inevitably, just like a certificate expires or we have something go awry after hours in IT or in our data center, or Saturday at, I don't know, midnight, because usually when things tend to always happen in your life in a hospital, that tends to be when, oh, guess what? I'm actually sick. Same thing. I can't get to my provider at midnight on a Saturday, but I can get to one of the myriad telemedicine providers that my insurance does cover. Guess what? Those records also do not make it back into my patient portal. And I have 2 different doctors here for myriad reasons as well. And they're both in the same EMR, but they don't have all my information. And so there's a couple key things when I think about patient engagement challenges. Number one, you have digital literacy gaps. Not all patients are comfortable with new technologies. It can be difficult to get them to access all the layers. Now, you tell somebody who is not as comfortable with the technology what I just shared with you, they're just going to stare at you. And then they're going to say, who can help me navigate that? If you are behind the scenes like we are, the fragmentation of our systems, getting the integration of these digital solutions is complex and it's inconsistent with the experience. Same reason I just shared with you. Half my records are floating all over California right now, and getting them in one place is still my responsibility, but it shouldn't be hard. And then I have an aunt who's 83, and she has issues with what she calls just, she knows trust and privacy because I've taught her those things. She's hesitant to fully engage with the digital platform because of data privacy and security. Now, this is the woman in her 80s who has that concern. And I'm like, what do you do if it's years and years earlier in your life where the exposure of your data. I mean, how many breach notifications did you get this year? Not necessarily from a healthcare provider, but you almost have an expectation that your information may be breached. And so how comfortable are
Right.
you with understanding how your physician or how your healthcare system protects your data to where people may not want to utilize all the features and functionality because they may prefer to call and go in anyway. And so we've got to get better at talking about how you can integrate systems, how your information stays safe, and the usability being something that's easy. Otherwise, people walk away from it.
It's all great. You talked about fragmentation, usability, data and privacy. All of those are challenges as we seek to build that better front door. And I know there's a poll question up around what are from the audience, what challenges you are seeing today, so you can vote. And we get a chance to see some of those results too. But while we see some of those results come in, let's move on to the next question, because you two are the enlightened ones. You know we need to do this. You know we need to do digital front door. We need to do it well. We have to respond to consumer needs. The questions then become around how do you actually implement that within a healthcare system's construct? So maybe Pam, I'll start with you. Tell us a little bit about how you're organizing or perhaps even reorganizing internal processes to support those front door efforts. What has worked? What are challenges that you're encountered or encountering?
Sure. I will say this, it's a slog.
Yeah.
And those of you who work in this space, you will be employed forever. Our job, and we see our job on our team here at HMH, is to knit together the clinical team, the operations team, the technology team, and the marketing teams to create a seamless digital experience. And that's our job. And so we're bringing together those folks to say, how do we do this together in a way that makes sense for patients and for ourselves? But to do that, though, I mean, we're very struck. I mean, we start with, people say, well, we start with the patient. No. We start with the customer. And one of the things that I did, and I do pretty consistently, is I actually have executives try to schedule their own appointments by themselves with no outside help, like kind of Sarah did. Yeah, call your call center. How's it going there? Let me know. See if you get in, or if you get something that's
yeah.
The other thing is that we've played tapes of our patients and their interaction. We've looked at we've come to our executives with the data. There's not an executive in healthcare that does not want to be involved in the digital movement. They all want. They all want to say that. They really do. They all have their heart in the right place. But what they have to do is change the mind. You have to change the mindset and say to them, it's going to be hard. I had our CEO the night before we were going live with our call center, our centralized call center, when we were pulling calls out of the practices. And he said, what do I have to be worried about? And I said, doctors are going to call you and they're going to be angry because we're managing their schedules now and we're filling them up. And I go, be prepared, be okay with that. And he has been, but we had to really make sure that everybody understood this is what it's going to look and feel like as we move through these phases. Now we're going to give you success. And the other thing that I would say to folks is that work in this area is report on the successes early and often and share them with your leadership, but also share them with the team that's doing it. When our call center hit 1 million patient interactions and 100,000 bidirectional texts, we celebrated that. We made sure everybody should know that. So that's kind of the things that how we approach it. We basically gather the data, and that data can be real live data saying, schedule an appointment, call me back in a week, tell me if you got one. And but all the metrics that are coming from our systems and the stories from the patients themselves.
Mm, it's really good. And then celebrate the wins early and often. Let
Yeah.
everyone know. I often speak to groups of leaders at health systems, and one question I ask them is, say somebody in your family or your friend circle got a terrible diagnosis, God forbid. Say that happens. Would you know exactly the steps it would take to get that person in and seen and to the right treatment path? And almost every time I've asked this in so many rooms, and they usually say our best option is to call a friend, call the head of department. But like nobody knows how, even as health system leaders, it's so hard to know how to navigate healthcare. So I really like your push on giving them the assignment to try to do it themselves, even something as simple as an appointment. What about you, Sarah?
When I think about really being able to embed digital
Mm,
transformation into a health system's culture,
mm,
quite often, a lot of these initiatives we're taking on can be multi-year. It takes a
yeah,
long time to get the whole portfolio implemented when it
right.
comes to these transformational efforts. And many of us have experienced executive changes
Mm,
during that time period. Happened to me at my last role. I mean, we had an amazing cloud transformation, going cloud native, going to infrastructure as code, yada, yada, yada. My CEO who hired me to do that left 2/3 of the way into the project. And I was like, I really hope that the new CEO still wants to do this because we're
right,
all
right.
basically at the point of no return. But if we hit the point of, oh my gosh, we have to reshuffle everything, it's going to completely change the dynamic of the trajectory that we are on.
Yeah.
So a ton of re-education of both the people that were still there about their roles and why they were doing it, but also being able to thoughtfully onboard my new CEO so that we didn't
Mm,
lose momentum in the project. And there were some key areas. Pam mentioned one, having a true change champion in an organization when people across the departments that are being affected are advocates for what's happening, they're going to ensure continuity even as people change because the technology itself might be changing, but we've made our decisions. And so, why we made them, memorializing and archiving some of those decisions so they're quick to recall for people to share is really, really important. And sometimes someone enters an organization, this was true, my previous CEO, who, by the way, he did support and everything went live as intended. He became the change champion because some of the
mhm.
resistors were like, "Ooh, this is our chance to say we don't want to do this." And I was
Yeah.
like, "Nope, I'm going to get there first and I'm going to share with him all these different perspectives." He became the change champion, so much so that during those final go live pushes on some of these initiatives, guess who was in the command center with IT? The CEO.
Wow.
Because he's like, "This is a big deal. This has to matter." Because I remember him saying, "What do you need
Mhm,
most from me?" I'm like, "Just show up for go live." And to Pam's
mm,
point, like have them call, have them try these different perspectives. All of that worked because of the years we put into having strong governance structure. So a team that oversaw the transformation made sure we were staying true to our strategic alignment and also accountability beyond individual leadership. This started to become about team
mhm,
accountability, team success, team ownership versus something happening to them, it was with them. And when we really asked for those product champions, so you had a business owner, a product owner, and an IT owner. When we
mm,
put those three things together, that trifecta was really, really successful. And then the ongoing training and support, because when you regularly invest in both your employee education, in the digital tools, and understanding how that culture can embrace technology and how the organization can be more adaptable to these changes, both from their leaders all the way through the continuum, it becomes pride and ownership because technology is really everybody's. My responsibility as a CEO to make sure it always works. It's also my responsibility to ensure that once you're the product and business owner, it's serving your needs the way that it's supposed to as well. And we're all adaptable and willing to investigate and look at that both retrospectively and towards the future. So those elements are just really, really important to have in place.
yeah. I think governance, as you said, is so important. Pam, I'm curious to hear governance on your end. What does that look like? Sarah talked about shared incentives. Are there shared goals across things like patient engagement, or you explore something like that?
Yeah, so we we purposely did not create a separate governance
Mm,
outside of the existing strategy governance for the network.
okay. Okay.
And so we said, oh no, we're going to align with the network strategies. We're going to write our goals to the network strategies. One of the network goals for every single executive in this company is a digital engagement goal.
Every
And
executive has a digital engagement goal.
they do. And
Wow.
it's the same one. We all have the same one. So
Okay.
yeah, they all come walk by and say, how we doing on the goal? Because year end, they're getting nervous. I'm like, oh, we're going to slide into home. I need your people to be doing X, Y, Z.
That's right. That's right.
We're all aligned. And that is, so for me, we have an executive strategy council and a president's council. And the executive strategy council is chaired by our CEO. And so we use them when we say, here's the strategy we're recommending. Here's what you've said our business strategy and our network strategy is. Here's what how we view that as it applies to digital engagement. Yes, no, or maybe. And they bless it. Then we take it to the President's Council, which for us is essentially all the operators, the head of the medical group,
Mm,
research, all the hospital presidents, all the operators. And we say, hey, here are the network goals, here are the strategy,
yeah.
here's what's been blessed, and we share it with them. So we use the existing governance because nobody wanted another meeting to go to.
That makes a lot of sense. And it helps keep it tied to the overall network strategy as well, versus it becoming a separate thread on its
Yeah.
own that people aren't connecting the dots. We have a question in the chat that I want to raise to both of you. Natalia Gimson asks, we've recently opened online scheduling for new patients in primary care, pediatrics, and OBGYN. We're thinking about the omni-channel experience that we want to build out for other specialties and conditions. Do you have advice on how to create a strategy to prioritize between specialties and conditions?
So we're in the midst of doing that. We're about halfway through the entire medical group. All our hospitals are online in our omni-channel patient access center, and about half of all practices are done, and we'll have it all done by the end of next year. All practices will be centralized. All scheduling and all access will be centralized at HMH. So here's how you prioritize. Well, you could do the kind of, let's hit the low hanging fruit first.
Yeah, sure. Yeah.
Kind of get used to it. Yeah. Because it's
Yeah.
a lot of work.
Get some practice. Yeah.
Actually go to the practices or the specialties who have raised their hands and said, I need help. It's always nice to have somebody who actually wants
you. Yeah.
who actually wants you.
Yeah.
Or you could say, this area is really in trouble. And women's health is dying on the vine. Their abandonment rate is at 60%. We've got to go in there and swoop in there and take it over. And so I think you have to decide what your immediate need is and what your culture looks like in your organization. I would also not do it without a partner like Sarah talked about. I mean, where is your business partner? Where's your physician lead? Where's your physician executive on this one? Don't go in and start ripping out schedules unless you've got the physician group on board.
Right. Right. So important.
Yeah,
important.
Pam, everything Pam says. I feel like Pam and I should, open a consulting firm someday because I'm like, yep. And I say all that because we also do it with a cheeky sense of humor because what we do is hard and you have to keep that pragmatism as a part of it. But I will tell you, for Natalia, exactly right, is create that psychological safety for the people making that move. Somebody runs that office. And it may not be the obvious person, but every office has a person who runs it. Maybe it's the MA, maybe it's the RN, maybe it's an associate physician. Somebody runs that place. They have to be on board. And when they agree that they need help, it's not that you hand them an out of the box solution. You say, here is how we've been doing this. How is this going to work for you?
For you. Yeah.
Open-ended. And then you tweak things where you can. You can't change all of it. You got to have a standard of implementation and excellence in your organization, but there are adaptability components of every project that can absolutely help those organizations or those offices that need it most. You're going to have some that are kicking and screaming coming across that line. Maybe they go last. Maybe your CMIO has a big piece of it. Maybe there's some influencers within the org. But I always made sure I had a personal relationship with the person who ran the clinic or the office or wherever aspect that was, because it was my commitment to them and the relationship that we had versus just me throwing something over the line and expecting them to somehow miraculously do it perfectly and not have a burden on both sides of the equation when we were done.
Yeah.
The other thing that I could tell you, those for folks who are really interested in online appointment scheduling, things like that, show your internal audiences that your competitors are already doing. Nothing will juice them up more in knowing that they got to catch up.
Yeah.
The other thing, I have not been above that stretch. I have done that. And the other thing that I think that you can do is when you show them that other people are doing it, but also show them that Google is prioritizing in their relevancy and rankings physicians who have online appointment scheduling enabled. So you can tell the physician, well, you don't have to do this. And when someone goes and searches for you in Google, they're not going to find you.
Yeah, that's a really effective one. Avia has been working with health systems on digital front door for the last 6 years. And there's two things we always do when we start an engagement on this. One is we do a secret shopper. So it's just like how easy or difficult it is to use your digital channels, including your call center. We'll pretend to be a patient and do that. And then also show the rankings on Google for just searching in your area. And then two, we do a competitor analysis of what your local competitors, but also what disruptors are doing. So don't just look at the hospital system down the road from you, but also every disruptor that is eager to get into your market, if not today, tomorrow. And then you can start to see very quickly how you rank amongst all of those capabilities, and that does become an impetus for different specialties and different department leaders to say, yeah, we need to start to address this. Of course, there's the ROI question with all of that too, which I'm sure you're all thinking about deeply, but that's a really effective way to do that. One of the things I wanted to get to is the idea of human-centered design, because it's very easy. Because I'll tell you in an anecdote, oftentimes I sit in rooms of executives who are like, we need to design this thing. And like, who are the decision makers on the design? Because if it's just the executives in this room, you are mostly of the same gender, you're probably of the same race, and you're probably of the same income range. So that's not your patient or the communities that you're designing for. You really need to look at that human-centered design and what is that person experiencing and how does it affect every group in your community. What have both of you seen in terms of using human-centered design or other techniques like that to incorporate into these initiatives?
I'll be happy to start because I just wrote an article about this last week, interestingly enough, and very specifically because we hear so much about it. And you don't want human-centered design to be a buzzword, just like patient first, it's kind of those obvious components.
Right.
There's certain things that really make a big difference. It's having the empathy and patient feedback when you're designing something. Involve your patients in the design process, whether that's through a survey, through a focus group, and usability and testing to understand pain points and needs. So I most recently came from a senior organization, and you think, how are seniors utilizing our product? And the fallacies around, oh, seniors don't use this level of technology.
That's
Actually,
right.
they do for keeping in
They
touch with
do.
their grandkids and their families, et cetera. But have
Yeah.
people using and helping you design the product that are the ones that are going to actually be using it, and it will give you the real feedback. So I'm hopeful everyone has patient focus groups in their organizations and that they really do utilize them effectively. Think about usability and accessibility. So I lived in Los Angeles for 6.5 years at one point, and we would test drive technology so that it's intuitive, easy to navigate, and accessible, most importantly, to diverse patient populations, inclusive of those with disabilities. What if they don't see well? What if they need to
Right.
have what if your screen design needs to come up so it's ADA compliant? And revamping websites to be ADA compliant is a whole new conversation for several
Yeah.
people. How many
Right.
languages does your product need to show up in? And it could be, you're in LA, you're talking 20, 30 languages in some cases,
Mm,
and it could be neighborhoods apart. And so I have one clinic that needs Korean, I have another one needs Mandarin, another one that
mm,
needs Somali, another one needs Spanish. They're all in the same circle that that office, as an example, may serve. And then the iterative design component, continuously
mm.
finding solutions based on the feedback and real world usage and ensuring that it's evolving with changing needs. We may think it's the coolest widget in the whole universe. If our
Right.
feedback says it's terrible, you're coming back to somebody and saying, hey, developer XYZ, they think our baby's ugly, we need to fix it. So
Right.
not being so personally tied to the
That's right.
design as we are to the focus of the intent, it's going to make
Mm,
a huge difference in producing products that people actually want to use.
that's fantastic.
Yeah, how we approach it too is pretty much the same way. We actually test it with our end users and do focus groups, put put the sites and the apps on sleds and say, show me how you can find a doctor. How do you find a doctor? And where do they start? Where do they end up? The first time I did it was about 20 years ago. And, it was when you do the old style focus groups, and it was the person, we were behind the mirror, like
Mhm.
order show.
Yeah.
And
Yeah.
I'm like watching people, and I'm like, I have designed this rocking thing. It's awesome. And so they asked somebody to, find a cardiologist. And like literally it was a 40-minute failure. And I like crawl through the window and say, just look, it's right there. The button's
Like there on the left.
didn't see a thing. And I think that you have to actually see that and see how people use it.
Mm,
I
mm.
really was earlier today. I was on a call with one of my coworkers and team members. They had built this form that they wanted to put in my chart, and it hadn't gone live yet. And so we looked at it, and I go, "Great, where's the button that says submit?" Oh, well, we're going to have it say accept. I go, "Well, what if I'm declining to participate?"
Right.
They hit a button that says accept. And they're like, "Oh." And so what we do here is besides the focus groups, there are principles of digital design and UX.
Mm.
And we have a team of people. We've sent them all. They all had to get certified in UX and UI to get that kind of work done,
Oh, okay.
and really kind of invest in that stuff. Like the search box should be always in the upper right corner. The logo should be in the upper left. Like there are some principles here
Basics. Yeah.
that we don't need to get creative on. We just need to be simple.
Some standards, right? You have to just adhere to. Yeah. It leads also to the question of equity. Particularly, there's a lot of discourse around the digital divide. And Pam, I'm curious, in a very diverse community in New Jersey that Hackensack is serving, how do you ensure that your digital transformation efforts, particularly digital front door, have that equity and accessibility component?
So the first thing we did is we make sure everything's mobile. They
Okay.
may have laptops. They may not at their homes. They are not everybody in our communities will have broadband in their house. They might not have Wi-Fi, but they do have cell phones.
That's
And
right.
actually make sure that our tools are um, really lightweight so that we're not data hogs also. And that's
Mm,
what I worry about. Some of the apps that I see some of these other companies do, these things are huge data hogs. And for some people, they're not everybody's on an unlimited plan.
data plan. Yep.
And so we have to be very mindful of it. So we want to make sure that our stuff is very plain vanilla, lightweight, and communicative so that they
Mm.
can manage it themselves. That's like, for us, that's the first thing that you have to do.
That's great. We have about 6 minutes left, so I'm going to move into our last set of questions here. This is the Women CIO panel. So I do want to ask, what has been your experience like being a woman leading technology and digital initiatives in healthcare And how do you mentor, support other women? How are you thinking about sponsoring the next generation of women to do the same? Sarah, maybe you start this one. Yeah.
Sure. Thank you, Sonia. I have always loved being a woman in technology for a couple of key reasons. Number one, I kind of like having to constantly prove myself. It actually makes me work harder
Hmm.
and be very specific and deliver high quality when I do my work because everyone's like, oh, well, there's nothing women in technology. No, there's not. But you know what? Those of us
Yeah.
that are, you are darn certain you're going to get the very best of us because we chose to be in this field, even if we were not highly represented. And so I love the ability to always put my best foot forward because I always have to. Like I don't get a day off from being the best version
Mm.
of myself. And if I do feel that way, then I'm going to go work on some really low value work like email so that, when I am hungry or angry or tired, as an example, then I'm not going to make a bad decision in front of the board. But I've always loved that aspect of it. The other piece is women make the healthcare decisions in families. We are also the protectors of our families and our lives. And so we are great in cyber. We are great in helping to navigate an industry where we're calling the shots at home. Why wouldn't we be wanting to do that in the office as well? It takes a few things to get there. You need to have representation and advocacy from your leaders, overcoming bias, and realizing that your greatest sponsor advocate may be your male boss, and you want the one who appreciates what your life is like, what your career and your life is like day to day. Finding mentors. And it's not saying, hey, will you be my mentor? It's more like surrounding yourself with other people, networking opportunities where you can ask questions and guidance. So you may not have very specific one-on-one mentorships. You may have many aspects of mentoring everywhere that you go. Because if I meet Pam and I know she's going to be at a conference, I'm going to talk to her about what I know she's really good at. And I can ask her, may I follow up with you in a couple of questions? And Natalia is an example. Natalia, let us know as your omni-channel strategy is rolling out, if you have a hiccup or a roadblock, call us. We're going to answer your
Yeah.
questions. And last is really having a supportive community, having places where the environment fosters inclusivity that helps pave the way for female leaders in healthcare. I've been in women-specific healthcare organizations. I just came back from a big conference in Atlanta last week that was all about creating support mechanisms and community for women who happen to also be in healthcare and technology. When you're in a room with 150 other women who are doing what you're doing every day, you've got kids, you've got parents, you might be the breadwinner, you have the career, you have a dog. Oh my gosh, you're on the road for this. Hey, who's taking care of me?
Mm.
All of these people around you who get that as well, who can just send you a simple text. This is a true story today. One of my best girlfriends has a husband going through cancer treatment and lives in Florida, having to evacuate one of the hospitals. And all I said was, are you okay? And I'm like, love you. And she says, thank you for checking in. I've got this. Love you too. I said, don't forget to let me know how things are going after the hurricane passes. You need those people. Go find them. And I'll tell you, if you are on this call right now and you don't have that person, reach out to us. We will make sure that you are absolutely not alone and do not feel that.
I want to, that was really, Sarah's absolutely right. And here's what I want to say. I actually have, I believe it is my purpose here to create more women health IT leaders and to create a path for them. I once was asked by a boss, well, he said, Pam, I noticed that all of the people that you're advocating for and mentoring through are women. And I'm like, uh-huh. And I said, yeah, yeah, I am. And that's what I'm doing. That's because you know what? There are not enough of us at the table.
Right.
I don't want women to lean into the table. I want us to flip the table so people understand our point of view and the skills that we bring to that table. That's really important. And I think that what my experience has been in my career is that it's never internally where I'm feeling like uh, the challenge of being a woman in health IT. I often feel it though when vendors come in and are pitching and they don't realize that actually I'm the decision maker.
Oh, wow.
Yep.
And so my message to vendors is be careful because we see that.
That's good.
We see that. And Sarah's right. If you do not have somebody advocating for you or somebody helping you kind of understand what this world is like, reach out to us. but it is absolutely, or we'll find people for you too. We all know people, but my
Yeah.
thing is we need to have more female leaders in executive health IT positions.
Oh, well said, both of you. Create more seats at the table, flip the table. I do that too. Quick anecdote. I remember there's one vendor that I was speaking to, and they brought 6 men to do this pitch, and I was like, do you have any women in your executive team? And that was their aha moment. It's like, so we need to advocate for creating diversity, sponsoring women, creating those seats for other women. Well, we're at time. I'm so impressed by both of you. Thank you for being just such a great conversation today. So thank you all for your time. And Leah, it's back to you.
Thank you.
So it's no secret that this is my favorite crew here. I mean, I have a lot of favorites, but I had a great time prepping with you ladies, and thank you for your inspiration. And healthcare is very lucky to have you, in my opinion. You're doing amazing things. So yeah, I'm seeing in the chat, girl power. Yeah, I'm really loving this. Thank you. I wish we had more time, but we appreciate all of your time today on Digital Front Door Day. And tune into our next session around call center automation with Intuit Health and NICE. Thank you, ladies, again. We hope to see you soon at one of the upcoming conferences. Thanks, Pam, Sarah, and Sonia.
Bye, everybody.
Thank
Well,
you.
bye.